as new molecular biomarkers are developed and discovered that have an impact on multiple myeloma, how is that going to impact the COMPASS trial?
Well, it's so interesting in myeloma right now because we don't have validated targets or validated biomarkers, and the truth is, when you look at proteasome inhibitors like Velcade or drugs like Revlimid, they are so effective in myeloma patients that we tend to look at them and say almost every patient in myeloma is likely going to be on a Velcade-based type drug or on an IMiD. So what you're really looking at over time is to say, well, what else is changing on these patients? And what we're finding are things are emerging like BRAF that we wouldn't have expected. And so what does that mean for the combinations of drugs? I think our hunch is that you'll often have myeloma patients that will be on a proteasome inhibitor and an IMiD. And what are we adding? What are we adding over time that's really going to help them? So I think as we move to that world, we really have to start to understand how we'll begin to work with diagnostic companies and how we'll start to build out the field of myeloma. It's going to be changing.
I think you can think of it at both ends of the disease. So if you can bring the right combination right at the patient's diagnosis, that's your highest chance of ultimately curing disease. And that's at Millennium, that's our aspiration. Ultimately, we want to cure cancers. That may not be possible in the very near term, but in the meantime, patients need therapy. And in myeloma, we've seen that with the new therapies, patients' disease is under control for much, much longer. But, as Kathy mentioned, these new mutations emerge that you might not have expected or perhaps wouldn't have seen a decade ago, but now you are seeing, and we can bring new combinations of therapy to bear against that because we are understanding, and we have now in our arsenal, some molecularly targeted therapies, for instance against BRAF. So science is moving as fast as it can to get ahead of the ingenuity of the cancer cell